I'm Dr. Kurtis Kowalski. I'm one of the orthopedic surgeons with Tennessee Orthopedic Alliance here in Clarksville. How many of you out there are runners? I know I am, and one of the most common injuries I see in runners is knee pain. So the first thing you need to know is if you develop knee pain on your run, stop running. Ice compression and elevation is really the name of the game here. Most injuries in runners are overuse injuries. Occasionally I see something structural, but it's pretty rare. The most common running injury I see that's an overuse injury is on the side of the knee, the outside portion of the knee. And we call that iliotibial band syndrome, or a lot of runners call it ITBS. The treatment for that is stretches, time off, and you can take some oral anti-inflammatories like ibuprofen or naproxen. But stretching is the name of the game for this, and it typically responds after about 4 to 6 weeks of stretches. If your pain is in the front of the knee, that is most commonly what we call runner's knee. There's nothing that's typically structurally injured, ripped, torn, or cracked. It's just a softening of the cartilage in the front of the knee that we see with runners frequently. Again, the name of the game for that is rest, ice, compression, elevation, time off, and sometimes a form of physical therapy program. If that pain doesn't get better in 3 to 5 weeks of conservative or non-operative care, then you should certainly see a physician to get some x-rays and consider further treatment. If the pain is on the inside portion of the knee, adjacent to your other knee, sometimes that's the tendonitis. Again, the name of the game for that is stretches, ice, compression, elevation, anti-inflammatories, and stretching the hamstring. So if pain still persists after 5 to 6 weeks of self-care, please come in to see us at Tennessee Orthopedic Alliance, our Clarksville location, or any of our locations.